Violet was born at the end of March, a little over a week before the due date. Her mother, Perla Estrada, realized her birth was coming early by an ultrasound appointment.
The doctor told me I have really low fluid and I need to go to the hospital.
She says she checked into the labor unit at the Royal Alexandra Hospital, revealing to staff that she's a Mexican citizen but is undocumented in Canada. Hours later, she was told by a nurse that she was required to pay $5,000 for an emergency C-section.
The nurse mentioned that it was an agreement between all the doctors that unless they paid cash up front, they will not give them medical attention. I'm starting to cry. Yeah. In that moment, I think in my baby and my health too, but first in her.
Estrada says the nurse recommended she go to another hospital. A friend drove her to the Misericordia Community Hospital. She says she got almost immediate care, leading to a successful C-section, and the bill was to be dealt with later, as she initially expected.
She should have gotten the medical attention and then the bill afterwards.
Diana Ramirez advocated for Estrada over the phone to try to help with any translation while she was in hospital. She's also assisting with filing a formal complaint with Alberta Health Services and the Human Rights Tribunal.
Thankfully, right now, I'm telling you the story of a baby that's healthy. But if she didn't know me, or if she didn't have family or friends, what would have happened to both her and the baby?
Alberta Health Services sent a statement to CBC News saying it's very concerned by the case and is investigating. And it confirms that in some instances, out-of-country patients will be billed, but always after they've received care, and that all patients will receive emergency care despite their ability to pay.
The kind of health challenges migrant workers face and what.
This professor out of Ontario is an expert in migrant worker rights, along with women and gender studies. She says the allegation of refusal of emergency health care related to payment could infringe on human rights in Canada and beyond.
Denying access to reproductive health care to a woman in a situation like this is actually counter international law and is one of the examples of a human rights violation that's taking place worldwide and should not be happening in Canada.
Estrada says she's expecting bills from both hospitals and plans to work out payment plans to deal with them. She's also consulting with a lawyer on her options for her to legally stay in Canada with Violet. Travis McEwen, CBC News, Edmonton.